Hello, my name is Aki. I am a consultant in acute medicine in the NHS and the Director of Learning at the Centre for International Medical Graduates. Welcome to the NHS. We know that IMGs who come to work and train in the NHS face several challenges before they arrive, when they arrive in the UK, and in the initial months of work. Some of these are knowledge and practice gaps. At the Centre for International Medical Graduates, we are providing solutions to these challenges through the courses and events that we organise for IMGs.
Some of these challenges include limited understanding of the structure of the NHS, how the different parts work together, and the implications of this for how patients are cared for. Our comprehensive 12-week Welcome to the NHS course, which will be an induction to practice that will explore such topics as the staff that work in the NHS and what their role is. For example, what is the difference between a Band 5 and Band 7 nurse? Who is an acute care practitioner and how do they work within a clinical team in acute medicine? What is the difference between a service manager and a divisional manager? We will cover topics such as consent, mental capacity assessment, decision making around the escalation of care, what is the respect form and how should this be used? What are clinical guidelines and how do they inform clinical practice in the NHS? What is the National Institute for Health and Care Excellence, NICE, and what do they do? These are concepts often unfamiliar to international medical graduates. We will also discuss pay, how to understand your pay slip, employment contracts, pension, managing money, and much more.
Another challenge that IMGs face is the gap that exists between professional practice in the countries we have come from compared to the NHS. This is often not an issue with medical knowledge deficit because this would have been assessed in some way by the General Medical Council prior to obtaining registration. So, whether from Nigeria, or India, or Pakistan, or Egypt, there will be variations in the way clinical practice happens in those countries compared to the NHS. And IMGs need to understand this because it has implications for how they work. So this is why we have co-designed a suite of courses with IMGs to support them during this period of transition.
Medication errors cost the NHS millions of pounds annually, in addition to the human cost to the patients in compromising their safety and increasing risk of mortality. We understand that international doctors may have limited understanding of safe prescribing practices within the NHS when they arrive to work or train in our hospitals. And this is why we have designed a safe prescribing course for international medical graduates. The course is an interactive, hands-on, one-day online event that supports them to bridge this practice gap. And whether it is about good antimicrobial prescribing practices or medicines reconciliation, prescribing of insulin or anticoagulants safely, we have a team of tutors that will support the learning around this topic. As one of the tutors, I deliver a session that covers antimicrobial prescribing and includes the high-risk antimicrobials that require therapeutic drug monitoring. These drugs are associated with a higher incidence of errors and those with serious consequences for patient health, and they require tailored dosing, monitoring, dosing adjustments, and hence they can come across as very complicated and cause a lot of anxiety. In the pre-reading material, there are examples given that we will work through in the session to give you this sense of practical application and ease, understanding how and where to look for the information relevant to your organisation. The feedback for the course as a whole has been very positive, and we understand that it is increasing confidence of the attendees in their day-to-day practice. And we hope that you will enjoy this course as much as they did.
We have recently curated the Safe Prescribing course for international medical graduates starting out in general practice. In this course, we'll be covering topics such as addictive medication prescribing, structured medication review, as well as shared prescribing protocols. These are all concepts that will be quite new for an international medical graduate. We'll be covering these and much more in the course.
The acute medicine for IMGs is our longest running course, and we're constantly updating it to reflect current clinical guidelines. We have worked with a Health Education England Foundation school to stream their IMG doctors through this course over the last 2 years, and the feedback has been excellent.
When I first heard about the acute medicine course for international medical graduates, I was quite impressed. Honestly, how comprehensive the course was, and not only did it tackle on important topics that you see on day-to-day practice, but it really tailors them in a way for someone who is coming to the NHS for the first time. So some of these things that we teach in the acute medicine course include important and crucial elements such as acute coronary syndrome and diabetic ketoacidosis. But it also looks upon your day-to-day practice such as acute kidney injury, infection, sepsis. Furthermore, the interactions with the tutors was really smooth. It is not death by PowerPoint, but far from it. And the way the course is done really is on a person-to-person basis. It's tailored to ensure that every person gains the most out of it.
Hello, my name is Antoine. Welcome to the NHS. After the courses, the doctor tell us that they feel more confident and less anxious about starting working in the NHS. They find it really helpful for night on calls, and they would recommend all our courses to all the new IMGs starting out in the NHS.
Here at the Center for International Medical Graduates, we are working to ensure that we give courses to both international medical graduates who are in acute hospitals, as well as those in their general practice. The courses that we release include psychiatry for IMGs, include arterial blood gas analysis and interpretation, non-invasive ventilation, as well as my personal favorite, the ECG interpretation course. This ECG interpretation course is facilitated by a consultant cardiologist who is an electrophysiologist and is able to take the most complex of ECGs and simplify them in a manner that is easily digestible and is always related to clinical practice. We are constantly rolling out new courses, so it's definitely worth signing up to the website to find out more.
Language and communication can be a challenge for some IMGs. Academic communication is rarely a problem because these are assessed through language proficiency tests prior to starting work or training. Often, it's the use of language to communicate with patients and colleagues in the social context of work that can be a challenge. We incorporate communication skills that are relevant to the topic in the design of all our courses, but we also have a professional communication skills course that will be facilitated by some highly respected professionals in this field.
As an international medical graduate myself, I can understand when people arrive in the UK, you would have a number of issues at the top of your mind. The first thing is work, but there will be other issues such as schooling, childcare, as well as housing. Now, I have a specific interest in well-being and supporting international medical graduates, and I will be working with the other several education fellows at the Center of International Medical Graduates to support you through this. I clearly remember when I first arrived in the UK at my first job, it was quite isolating. And I was very grateful to have the experience of meeting people like me who had worked in the NHS, and we could share experiences together. At the Center of International Medical Graduates, we will be looking to support you through this process, and we'll be looking to work with other NHS and private organizations that want to do this.
The advice that I would give new MGs when they settle into a new ward would be to always ask for help. There is various people on the wards and there's always somebody who can help you. So always ask for help.
Getting this support right from the outset is important. It builds confidence in these doctors who are more likely to be better adjusted at work, less likely to make clinical errors, which can only be a good thing for patient care. We work with several tutors, drawing on expertise from across the NHS workforce to curate courses, which are co-designed with IMGs. We are able to design bespoke courses for NHS organisations, and indeed have done for a health education postgraduate school. We are interested in having these sorts of conversations around how we can help organisations support their international doctors.
We have had over 900 doctors attend our courses and events in the last 2 years. Some of these courses are free and some are for a fee which our participants can claim back against their study leave budget. Sign up for our courses, and to find out more, whether you're an international medical graduate, NHS manager, programme director or recruitment agency, simply get in touch.
From Nigeria to West Yorkshire, welcome to the NHS.
From Pakistan to Birmingham, welcome to NHS.
From Saudi Arabia to Lincolnshire, welcome to the NHS.
From Bangladesh to Kent, welcome to the NHS.
From Nigeria to Cambridge, welcome to the NHS.
From France to Lincolnshire, welcome to the NHS.
From Nigeria to Cambridge, welcome to the NHS.
From all of us at the Centre for International Medical Graduates, welcome to the NHS.